We'll address the network and take a few questions. So this year, as in the past, the GLBT network activities have focused on volunteering in the community and at MD Anderson. This year we did the Pediatric Fall Festival. We've also hosted a variety of educational events. We did an expert panel on transgender issues and health issues in the gay and lesbian community. And we had scholars from Rice, including Jill Carroll, who spoke on spirituality, sexuality, and respect, and also Stephen Kleinberg, who spoke on the changing attitudes towards the GLBT community in Houston. We've also been able to host community leaders like Anise Parker and Ellen Cohen. And once again, for the 5th year in a row, we proudly represented Houston at MD Anderson at the Houston Pride Parade. In parallel, we have directed special efforts to better understanding and addressing the needs and expectations of GLBT employees at MD Anderson. We have taken a rather rigorous approach examining the Corporate Equality Index and the Healthcare Equality Index produced by the Human Rights Campaign. In addition, we have 3 years of surveys from the GLBT network membership from 2006, 7, and actually 2011. And we also examined the state of GLBT recognition, equality, and benefits at the other UT components and at Texas universities. First, if anyone hasn't had a chance to see the article Employee Notes, MD Anderson ranks a perfect 100% on the Healthcare Equality Index. This is a tremendous distinction. There are 4 criteria that make up the Healthcare Equality Index. The first is patient non-discrimination policies. Next, visitation policies that protect the families of GLBT patients. Thirdly, an employment non-discrimination policy that includes both sexual orientation and gender identity. And lastly, training in LGBT patient-centered care. So we scored 100%, and there were only 153 healthcare facilities in the country that achieved this distinction. So we are tremendously proud. However, when we further examined the Corporate Equality Index, which is an unbiased assessment of employee benefits, our institution didn't fare quite as well. As you can see, based on the criteria, this is mostly due to the lack of employee benefits for GLBT employees. However, we do have the equal opportunity policy in place. In addition, we have the organizational GLBT competency, including the GLBT network group as part of this. And MD Anderson has demonstrated a public commitment to the GLBT community. So the deductions come in the second category, including medical benefits and soft benefits to GLBT employees, and also transgender inclusive coverage in the health insurance. And if you look at the bottom, you can see, so we scored a 65%. There's about 44% scoring lower. Those are mostly small companies. And then in the group that scores really well, over 90%, a lot of those are pharmaceutical companies. So to briefly summarize the network surveys that we received from our members, we saw 3 general themes. The first of all was network goals. GLBT employees here would really like same-sex benefits and to be involved in any MD Anderson policy-making criteria. In addition, the network seems to appreciate our focus on the 3 educational, social, and advocacy issues that we've been hosting. Lastly, we saw something that slightly disturbed us. There are definitely employees here with a fear to be out. They have a fear of being singled out or a fear of retaliation from their coworkers. Despite the fact that MD Anderson has a wonderful EEO policy that does cover sexual orientation and gender identity, we still see this. And I myself, along with several others from the executive committee, witnessed this at the Diversity Council Fair when at a table we had an older woman employee came up to us and asked what GLBT stood for. And when we told her, gay, lesbian, bisexual, and transgender, she ran away from us and yelled that she could not speak to us. So based on these sources, the executive committee has identified 4 major sectors that we will focus the network efforts that we believe best represents the values and visions of as many GLBT employees as possible. I'll discuss a few of the important highlights. However, we do have posters that give quite a few more details. So, strategic initiative number 1 examines employee benefits. In this, we're talking about equal rights for the same-sex partners of MD Anderson employees. So this includes parental leave, family and medical leave, bereavement leave, a comprehensive health insurance plan, and retirement benefits. In our research, we found that UT Austin has been able to offer some of these soft benefits, including FMLA for the birth and adoption of a partner's child, library and fitness center privileges for partners. Their Employee Assistance Program offers counseling for couples and partners. They're able to designate their life insurance beneficiary as a partner, and UT Austin also provides childcare. We also examined other state universities. Rice and Baylor, which are both located close by, do offer domestic partner benefits. However, they are private and not restricted by the state law. So we do very well recognize that the state law of Texas prevents defining marriage for same-sex couples. However, there are several state universities in other states with very similar laws to Texas who have been able to work around this and find a way to offer domestic partner benefits. These include Michigan, Ohio, and Florida. While we realize that achieving these benefits may not be easy, we would like to make sure the administration knows that we are looking forward to working with you and anything that we can do here to help at MD Anderson. Strategic initiative number 2 focuses on outreach to GLBT patients in the community. This can be done by providing an atmosphere that clearly indicates non-discrimination to the GLBT community here at MD Anderson. A few suggestions we have could be an insert in the patient newsletter called FYI, and also on the external MD Anderson website, where many patients first learned about MD Anderson, having something that clearly states that they are non-discriminatory towards these patients. Also, we believe it's important to make sure that people realize that they can define their medical decision maker, their primary decision maker, and whoever they would like to be informed of the change in status, whether it's a related person or their spouse. We realize the Joint Committee has commented on some of these things in the last year, so we're looking forward to seeing those policies come through. In addition, we have worked with MD Anderson for involvement in the GLBT healthcare community. MD Anderson has had cancer screenings and also information groups at places like Lesbian Health Initiative. And research has shown that the GLBT community gets less routine care. According to the American Cancer Society, this could be due to lower rates of health insurance, a fear of discrimination, and also negative experiences with healthcare providers. Something that we have never heard from the GLBT community here on behalf of our patients, and we are very proud of that. The American Cancer Society also cites higher risk factors in the GLBT community. Lesbians tend to smoke more often than straight women at a rate of 25% versus 15%. So, strategic initiative number 3 focuses on enhancement of non-discriminatory behavior in the workplace. There is currently quite a bit of this going on, and we would like to see it continue. We have a few suggestions, including requiring that all managers, any employee with direct patient contact, and any employee with a role in policy making take education center classes regarding GLBT awareness. In addition, we'd like to begin to establish some metrics, so possibly including questions in the big survey, which is done every 2 years. Thirdly, we have our own commitment to education through the GLBT network meetings. Many of our meetings are aimed at educating all of MD Anderson about GLBT issues. We're not focusing strictly on our members. And lastly, we suggest the Employee Assistance Program could ensure that it has GLBT-focused programs and resources that we would be able to use. Possibly lawyers with an awareness and sensitivity towards GLBT issues like estate planning. And lastly, as part of establishing further metrics, we'd like to track career development for GLBT employees and have specific leadership opportunities directed at GLBT employees. And you may wonder why we're asking for this. That may sound like special treatment. But the necessity for this comes from what we need to ask for in Strategic Initiative 1, 2, and 3, which is offered to all employees at MD Anderson. So this concludes my presentation. We believe this is a time to engage the upper administration to make progress in some of these essential areas. The reason we have invited Dr. DePino here today is we would like to engage you as an ally for these employees. It is clear that you are the wind of change at MD Anderson, and we are honored to have you with us. At this time, I'd like to invite you to address the network.